Borrelia is a really elusive pathogen, and the currently widely available testing which we have is all antibody testing, antibody detection, which is indirect. This really only tells us if the immune system sees the bacteria. It doesn't tell us if the bacteria is currently there, if it's present, if it's active. And there's also a wide variability in immune response at all stages of the infection, and so the antibodies don't always show up reliably. In general, there's a really wide agreement across the field of academics and researchers and clinicians that we need better tests, and especially we need direct detection tests that can definitively tell us if the pathogen is currently present and active. And we have found that the direct detection tests with the Lyme urine antigen can really help us to capture cases that the serology either missed or where there's some uncertainty or some murkiness and some discussion around, is Lyme, the driver of this case or is it not? And it can also be very helpful in confirming that Lyme disease is currently active in the patient, which we don't have many other tools that are reliable for this. So it can be super valuable for us. I had a patient, a young woman who came to us when she was around 16 or 17 years of age. She had been diagnosed with juvenile arthritis at age 14, tried a bunch of interventions, including holistic as well as Enbrel, and had some pain relief, but then was getting frequent infections and it stopped working and was basically going down this rheumatological path. And but the parents had some concerns around this. They did some initial Lyme disease testing, given the fact that they knew that that was a possibility. And there was some findings. It was initially read as negative, but there was an IgG 93 band. The P93 band was there. And if we think about this concept of Lyme bingo that Richard Horowitz has talked about a lot, if there's any significant band, if there's any Borrelia specific band that's present on an antibody test, on the immunoblot, on a Western blot, what that's telling us is that there's likely exposure. And when I saw that, I said to the family, I said, this is not nothing. I'm not going to just write this off as negative as was previously done. And I think that we really need to do more testing. So we did additional antibody testing with several different labs with mixed results, as is commonly the case. I immediately said to the family, hey, I am concerned about Lyme disease. I do think that we should pursue this. We did start some treatment and she was making some progress, but the family was also working with other providers and rheumatology and infectious disease. And, there was a discussion around, hey, are we doing the right thing? And she was getting mixed messages from the care team, and with me encouraging them, that I do think this is the right path, especially since we're seeing treatment response. And so at that point, I ran the Galaxy Lyme urine Nanotrap test, and it came back positive. It really showed us that yes, Lyme is active, yes, Lyme or Borrelia is present, and that the urine antigen test being positive really solidified the care team and brought everyone on board, including family members and other providers. And we completed the course of treatment to the point where this young woman was completely back to health and was able. She had previously been a surfer and a competitive swimmer. She's doing well still. It's been a number of years now since we stopped treatment, and so I'm just really grateful that she's back in her life and able to function at a normal level now. Ideally, we recommend that patients collect their sample first thing in the morning before eating and drinking, so that we can provide the most concentrated sample, which can improve accuracy and yield. And if the patient's a female, we generally recommend that they don't collect the sample when they're menstruating, since that could interfere with the results. And we're looking at techniques of maybe increasing the yield or provoking the test a little bit. For example, potentially integrating massage or even sauna, particularly with massage, any trouble spots, any pain spots, massaging those somewhat vigorously the evening prior to collection. We don't really have data yet to prove this out, but there's been some interesting anecdotes about this. And in addition, we're exploring potential antimicrobial, whether herbal or antibiotic provocation methods, to see if that might also increase the shedding of the antigen in the urine and therefore increase the yield of the test. But all these areas are still in exploration, in development, and so we don't have any concrete recommendations there yet.